Hello friends, welcome back to Dr. Jaggis Academy. In today's lecture, I will discuss about the remaining part of the antihypertensive drugs, that is antihypertensive drugs part 2. So let's begin. If you remember the last lecture of mine on antihypertensive drugs, I discussed the first line agents like thiazide type diuretics, then selective beta-1 blockers, calcium channel blockers, particularly the dihydropyridine type, and then the drugs that modulate renin-angiotensin system. So if you want to go and study in detail about these kind of the drugs in the hypertension, just go and click the link which is given in the description section. So what we will study in today's video? We will discuss what are the second line agents in the treatment of hypertension. So first category is the vasodilators that dilates the arteries. So now in this category we have a number of drugs, like first is the alpha-1 receptor blocker. Examples: prazosin. We will discuss prazosin as a prototype drug. Then tirazosin, doxazosin. So you can see they are named as zosin. Okay. Then we are having the non-selective alpha receptor blocker. They are selective alpha-1 receptor blocker. They are non-selective alpha blockers, like phenoxybenzamine, then phentolamine. Third category, which directly vasodilates the arteries. Now the drugs: hydralazine, minoxidil, sodium nitroprusside, and diazoxide. Then another very important category, that is central sympatholytic drugs. Now we are having two drugs in this category. One is the clonidine and second is the methyl-dopa. So another is the combined alpha and beta blockers like labetalol and carvedilol. Now we will discuss all these drugs individually, one by one. First of all, coming down to the alpha receptor blockers. So now you remember that we discussed the sympathetic nervous system. There are two kind of sympathetic receptors. One is the alpha receptors and second is the beta receptors. Alpha receptors are further of two types, alpha 1 and alpha 2. Now what is the basic difference between these two receptors? Alpha 1, they are present post-synaptically on the blood vessels, and when these alpha 1 they are activated, okay, then they produce vasoconstriction, and vasoconstriction will lead to the increase in the peripheral resistance, which is associated with the rise in the blood pressure. And if you use alpha 1 blockers or you use non-selective alpha blocker, okay, these will block these receptors. Okay, once these receptors are blocked, the vasodilation will take place, no vasoconstriction, no rise in peripheral resistance, and no rise in the blood pressure. So ultimately you can say there is a decrease in the blood pressure. Okay, so for the more detailed information about the sympathetic alpha 1 and alpha 2, you can go and click the link which is given in the description section. Now, selective versus non-selective alpha blockers. So if you want to treat hypertension, we prefer alpha 1 blockers. Selective alpha 1 receptor blockers, they are preferred over the non-selective. What is the reason? As the name indicates, non-selective alpha blockers, they block both alpha 1 as well as alpha 2 receptors. Now again you have to go to the basic pharmacology that I told. Go into the description section. These alpha 2 are inhibitory. Okay, so when that means if you activate these two, then they inhibit the release of norepinephrine, autoregulatory mechanism. Okay, so that means if you inhibit these alpha 2, the function of alpha 2 is to reduce norepinephrine. So if alpha 2 is not acting, ultimately there is an increase in the norepinephrine release. So that means blockade of alpha 2 will lead to increase in the norepinephrine, and obviously if there is an increase in norepinephrine, there is increase in the heart rate and increase in the cardiac output. So ultimately there is no effect on the blood pressure. Tolerance, you can say, ultimately tolerance will die. But if you use alpha 1 blockers, there is little increase in the heart rate, because heart rate here it was increased because of the increase in the norepinephrine. So that is why we prefer alpha 1 blockers over the non-selective alpha blockers. So now, what are the side effects of alpha 1 receptor blockers? First is the postural hypotension, which is also called as orthostatic hypertension, and it is an important side effect. What is the meaning of this word actually? That means when the person is in a laying position, person is laying on a bed, and when he stands up, then there is a fall in the BP, that is fall in BP on standing. That means change in the posture. When the person is in a laying position, he stands up, there is a fall in the blood pressure. And that is called as the postural hypertension. That happens if you use alpha 1 blocker. And it is particularly very important when you take the first dose of the prazosin, which is a prototype, that is first dose of the alpha 1 blocker. So what is the remedy? So what is the precaution? So start with the low dose of the prazosin. Okay, don't give the high dose, just give the lowest dose. And when you have to give at the time of the night, because the person will go into the sleep and he is not changing the posture by standing. So this is the thing, and ultimately when you keep on giving this drug, tolerance well to this kind of the side effect, and person start tolerating this postural hypotension effect. Okay, so this is one of the most important things. So this is the remedy you have to remember. First dose effect. Okay. So this is called as first dose effect. So other side effects. Fluid retention. Again an important side effect I will tell. Third is the reflex increase in the heart rate. Now these two side effects, you have to remember, fluid retention and reflex increase in the heart rate. These are always associated whenever you are using any kind of the vasodilator. Any kind of vasodilator means any kind of the drug which dilates the arteries, mostly. Okay, so I will discuss more drugs also, like hydralazine, which is a direct vasodilator. So if you compare two drugs, alpha 1 blocker and hydralazine, and you compare which drug is having more effect on the reflex action with respect to increase in the heart rate, so your answer will be that prazosin is having lesser effect than the hydralazine. That means hydralazine is having a more pronounced effect on the fluid retention and on the heart rate. Prazosin is having a relatively lesser effect, but prazosin do produce the fluid retention and the increase in the heart rate as a reflex action. Okay, so these are the side effects, again I am repeating, associated with the arterial vasodilators. And how you will come to know there is increase in the heart rate? It is manifested in the form of palpitations. So as I told, all vasodilators have these kind of the side effects. And what is happening? These two side effects ultimately they attenuate the antihypertensive effects. That means let's say you are giving alpha 1 blocker. They are producing their effect for a certain period of time, but after few months or few years you can see the effects start falling down. That is a tolerance, decrease in the antihypertensive effect. Why this is happening? Because of these three things. So now what is the remedy? That means you are giving alpha blockers, but now the effect is not coming. So what is the remedy? So you have to overcome these two. How? What is the remedy? Give diuretic. Diuretic what will lead to? It will remove the fluid. Okay, again the effect will start coming. Increase in the heart rate is overcome if you give beta blockers. So what is the answer of this question? That if alpha blocker is not producing the effect after a certain period of time, that is tolerance has developed, then what is the remedy? Then give diuretics, that will overcome the fluid retention, give beta blocker which reduces the heart rate. So this is the thing that you have to remember. So this is the remedy whenever these two things are happening with any kind of the vasodilator, not only with prazosin, with any vasodilator. So now this is again an important side effect, sexual dysfunction in the males. Some other side effects, dryness in the mouth, nasal stuffiness, headache, weakness, these are the other side effects. So if you compare the first line agent and second line agents, you will see obviously these side effects are relatively higher in the prazosin in compared to other drugs which we discussed in the last lecture of the first line agent. That is why this is not a first line agent because of these side effects. These side effects and because of development of this tolerance. Now coming down to the non-selective alpha blocker. They are not used routinely to control the blood pressure, but they are used only in the special conditions for the short-term management of the blood pressure, very high blood pressure. Particularly when the circulating levels of catecholamines are very high, when there is a very high level of catecholamines, okay, norepinephrine, epinephrine, and there is a very high BP, and this is an emergency condition and you want to manage for a short period of time. Now I am giving certain examples. What are those conditions? Like pheochromocytoma. Pheochromocytoma is a tumor of the adrenal medulla. So there is a excessive release of norepinephrine. Second, clonidine withdrawal. I will discuss clonidine. Clonidine is an antihypertensive drug. You keep on giving the drug, but let's say a person misses 1 or 2 doses. So what will happen? There is an abrupt rise in the blood pressure, shooting of the blood pressure. So sudden withdrawal of this antihypertensive lead to a sharp rise in the blood pressure. So this is again an emergency condition. Or there is a cheese reaction. What is this cheese reaction? Now when you are giving some MAO inhibitors, they are used for the management of depression. Then you instruct that patient that don't use certain list of the drugs or certain list of the food items. One of the food item is the cheese. Let's say a person is using MAO inhibitor and he is taking certain food items like cheese, then there is a very high rise in the blood pressure. So that is called as cheese reaction. So if in these 3 conditions, for the short-term management of the blood pressure, you can give these non-selective alpha blockers along with the beta blockers. Not alone, but in combination with beta blockers. Now this is the first thing that I finished, that is alpha blockers, which act as vasodilator. Second category, which act as direct vasodilator. And very important category in this category, very important drug in this category is the hydralazine. It directly acts on the arteries and produces the vasodilation, and which leads to the decrease in the peripheral resistance and decrease in the blood pressure. Now where it is used, its special indication is the antihypertensive in the pregnancy, including preeclampsia. Preeclampsia is again a rise in the BP in the pregnancy condition. Otherwise it is not routinely used because of the tolerance and the side effect. What are the tolerance? Why tolerance happens? As I told, a fluid retention and increase in the heart rate. So what are the side effects? As I told, reflex tachycardia, because it reduces the blood pressure, and to compensate the blood pressure, body try to increase the heart rate. Second, fluid retention, which leads to increase in the cardiac output. So because of these things, there is a tolerance to the antihypertensive. So what is the remedy? Use beta blockers or use diuretics. Some other side effects. Now if it increases the heart rate and person is a heart patient, then it may precipitate the angina, because increase in the heart rate increases the myocardial oxygen demand. Even myocardial infarction can be precipitated, particularly if the person is suffering from some coronary artery disease. Now again, this side effect, fifth, is common side effect. Any drug which produces the vasodilation produces this side effect. Flushing, increase in the blood flow in the mouth, in the face, you can see, face become red. Then thropic headache. Vasodilation in the carotid, in the arteries in the brain produces the headache, and thropic headache, it is a characteristic feature. Dizziness, and as I told, they are due to the vasodilation. Again, a very important side effect associated with hydralazine. This is called as systemic lupus erythematosus. In short, it is called as SLE. This is the side effect. It is associated with the hydralazine, not in all persons, but those persons who are deficient in this enzyme, acetylation. The persons who are not having, you can say, the fast acting acetylators, they are called as slow acetylators. That means in those persons the metabolism of hydralazine is slow. Okay, so this is a pharmacogenetics actually. We will discuss this point in some other lecture when I will discuss the pharmacogenetics. That means effect of the certain genes on certain things. So that I will discuss separately in some lecture. Second drug in this category, minoxidil. It is again a vasodilator. Now what is the mechanism? It opens the ATP sensitive potassium channels. ATP sensitive potassium channels. So when this potassium channel is opened, potassium moves from inside to outside, because potassium is higher inside. So there is opening lead to the outward movement of the positive ions. So what will happen to the inside? Inside will become negative, hyperpolarization, more negative. As a result, hyperpolarization, more negative, relaxation. Relaxation means, you can say, there is a decrease in the peripheral resistance. But it is not a preferred antihypertensive, because of the same side effects are discussed with the hydralazine, headache, those kind of tolerance, increase in the heart rate. But this minoxidil has found some other use. It is used in the alopecia, baldness actually. So when you apply this minoxidil topically on the hair, so that the hair growth can be there, minoxidil. And what happens is that when you apply locally, it increases the blood flow because it is a vasodilator, and it stimulates the hair follicles to grow. So this is the place where we can use, not as an antihypertensive. Then a very important drug in this category, sodium nitroprusside. So what is the mechanism? Sodium nitroprusside releases nitric oxide, and because of this release of nitric oxide, there is a vasodilation and there is a decrease in the blood pressure. So what is the characteristic feature of this sodium nitroprusside? It is a very fast acting drug. Very fast acting drug. And if you give intravenously, the effect will appear within seconds. But it is not a long acting drug, it is a very short acting drug, just 2 to 5 minutes. So what will happen? It is not that you have given a single injection of IV of sodium nitroprusside and you can expect a fall in the blood pressure for a long period of time. So what you have to do is that you have to continuously give nitroprusside for a certain period of time, so that the blood pressure remains to the lower state. So now if you see that you have to give some drug intravenously, so obviously this is not the case in the normal condition, that means day-to-day life. It happens when the person is in the hospital because of the emergency condition, hypertensive emergency, very high BP is there. So then you want to control the BP in a short period of time, then you give this sodium nitroprusside. So what we give? You take 50 milligram of the drug, dissolve in 500 ml of the solution, then you infuse the drug slowly. So what is the precaution? So now the special precaution is that if you give excessive sodium nitroprusside, what happens is that there is an accumulation of isocyanate. This isocyanate may be toxic. Okay, it starts binding with the hemoglobin. So what is the remedy? You give sodium thiosulfate. It will neutralize thiocyanate, it will be eliminated from the urine. So this is important thing you have to remember. Excessive dose may lead to rise in the cyanide or isocyanate, and you have to remove it using the sodium thiosulfate. Another category, central sympatholytic drugs, and the two drugs in this category are clonidine and methyl-dopa. So now if you see the name central, that means they are acting in the central nervous system, that means in the brain. Sympatho, that means something related to the sympathetic nervous system. Lytic, something destroy. So that means these drugs act in the brain and destroy or inhibit or attenuate the sympathetic nervous system. So what happens is that these two drugs activate alpha-2 receptors, in the brain stem, in the brain. So as I told, alpha-2 receptors are inhibitory in nature. If you activate these two receptors, what is happening? Inhibition is produced. So activation leads to the decrease in the sympathetic outflow from the brain. That means from the brain, the sympathetic flow from the brain to the periphery is reduced. If sympathetic flow is reduced, obviously the BP will be reduced. So if you discuss about the clonidine, it directly activates alpha-2 receptor. It is a imidazoline derivative, if you discuss the chemistry. But alpha-methyl-dopa is actually converted into the alpha-methyl norepinephrine. Like dopa is converted to norepinephrine, this is alpha-methyl-dopa, which is converted into alpha-methyl norepinephrine. This alpha-methyl norepinephrine now acts on the alpha-2 receptors. So alpha-methyl-dopa, where it is used to maintain the blood pressure in the pregnancy. Other drugs, as I discussed previously, hydralazine can be used. One more drug can be given. I will discuss labetalol, that I discussed in the previous lecture also. Side effects of methyl-dopa. Same side effects that we discussed with the alpha-1 blockers. If you see, dry mouth, nasal stuffiness, headache, sexual dysfunction. These are the side effects which are common with the alpha-1 receptor blockers, prazosin. So now this is different thing. So what happens is that in some persons, methyl dopa may lead to the hemolytic anemia. It may lead to activation of the immune system, autoimmune system is activated. How it can be detected? Using a positive comb test. You do a immunological test which is called as the comb test, and if it becomes positive, it indicates some immune system is activated. So with the alpha methyl dopa, you get a positive comb test, which is a problem which may lead to the hemolytic anemia. And I will discuss with clonidine that clonidine produces the rebound hypertension if you miss 1 or 2 doses, but this is relatively lesser with the methyl dopa. Okay, clonidine. So we don't prefer clonidine. It is also having a similar side effect I discussed: dry mouth, nasal stuffiness, headache, okay, sexual dysfunction. These are also same with the clonidine. But additionally, the major problem is that it produces severe rebound hypertension. That means missing 1 or 2 doses of clonidine will lead to alarming rise in the blood pressure. So side effects, as I told, very similar to alpha methyl dopa. What are the other uses of clonidine? Not preferred as an antihypertensive agent, but some other uses, like you are having some opioid patient who is dependent on opioids, or person is on alcohol, addicted to alcohol or opioid, and if you don't give opioid or alcohol for a certain period of time, the person start developing withdrawal symptoms. To manage those symptoms, you can give the clonidine, because those symptoms are happening because of the activation of the sympathetic nervous system. Clonidine reduces the sympathetic nervous system, so reduce those symptoms with opioid and alcohol withdrawal. It can be used to control the loose motion in the diabetic condition. So long-standing diabetic produces number of complications, including the autonomic neuropathy, and one of the manifestation is the loose motions. That is not controlled by some commonly used drugs. Then you can give the clonidine in that condition. Then it also acts as an analgesic, pain reliever, and in the menopause, it may be used to control the vasomotor symptoms. These are the other uses of clonidine apart from the antihypertensive. So now the last category, combined alpha and beta blockers, labetalol. I discussed in the previous lecture also labetalol. It blocks beta receptors and alpha receptors. It is having a faster onset of action. So because of the faster onset of action, it is again used to control hypertension emergency conditions, where we use, you can remember phentolamine, phenoxybenzamine, like clonidine withdrawal, cheese erection. Other use, it is used to control the blood pressure in the pregnancy, like preeclampsia condition. Carvedilol, it is again a beta blocker, alpha blocker. Additionally, it is an antioxidant. It is used in the congestive heart failure as well as in the hypertension. So this is what I wanted to discuss with you in the antihypertensive drugs. In the upcoming video, I will discuss about the drugs which are used to treat the congestive heart failure, including the classification, mechanism of action, side effects and their clinical status. Thank you.